It is a pleasure to be here in this webinar. I am the head of infectious disease at the Hospital Sant Trias, which is a hospital north of Barcelona. And together with Lourdes Mateu, Lourdes Mateu coordinates in my team. She coordinates the largest long COVID unit in Spain. The first thing is that we need to address long COVID early. So, of course, long COVID is a consequence of acute COVID-19. We have decided, and our societies have decided as a whole, although some people might disagree, that we're going to let the virus circulate among us and we will become infected several times during our lives. And this is something that the societies as a whole, as I said, not everybody would agree, but the societies as a whole, this is what they have decided. That implies that there will be a fraction of these acute COVID-19 infections that will transition into long COVID. So we really need to develop, strategies, including prevention, of course, of long COVID, and of course, very desperately, we need clinical trials that allow us to cure long COVID, which is not going to be easy, but we need to work on that. When we zoom into the variants, but you can see this is a cross-sectional study cohort of more than 15,000 adults surveyed between February 2021 and July 2022 in different states in the US, including District of Columbia. And here you see the risk of developing long COVID compared to the ancestral variant. And so you have epsilon, alpha, delta, and omicron. And yes, omicron is associated with a lower risk of developing long COVID than the ancestral variant, and clearly lower risk than delta. But what you can also see here is that we don't know exactly, we cannot be completely sure what will happen in the future. There might be other variants that with a different outcome or risk of developing long COVID. So far, Omicron is associated with less risk of developing long COVID. However, there are so many different infections that in absolute terms, we are still seeing new long COVID cases in individuals infected with Omicron. And the worst thing is that Omicron, once you develop long COVID with Omicron, your clinical course and data from Denmark is showing that if you develop long COVID with following an Omicron infection, you have the same clinical course. So it's still persistent, and it's very similar to the long COVID that develops with previous variants. Another study in this case in the UK, very large study, more than 50,000 individuals, essentially confirming that the relative odds of long COVID in the UK during the Omicron period were lower than in the Delta period, again in the UK. So in conclusion, Omicron, in comparison with the previous variants, is associated with a relative reduction in the relative risk of developing long COVID. However, we don't know what the next variant will bring us. And also the number of infections is so high that this leads to a significant burden of new cases during Omicron. Thank you for listening.